So that brings us to the end of the pectoral axiopendicular muscles. Now we will start our discussion regarding the scapulohumeral muscles, the intrinsic muscles of the upper limb. We will be discussing the deltoid and the four rotator cuff muscles, that are the supraspinatus, infraspinatus, teres minor, and subscapularis, and teres major muscles. Although technically biceps and triceps can be considered scapulohumeral muscles because of their attachment of long heads to scapula, but we will leave that discussion with the arm along with the coracobrachialis muscle. So here is a picture for a screenshot if you want from the Keith Elmore's anatomy regarding origin and insertion. Let's dive into them one by one. The deltoid muscle. So deltoid was the large muscle that is forming the contour of your shoulder joint, all this part. So this is the deltoid muscle, and it has the anterior parts, it has the acromion part, and it has the posterior part. You can see well here. Let us break it down its origin and insertion. The origin, it's from above. It's from the anterior aspect of lateral one third of the clavicle. It is from the outer aspect of the acromion, and it is on the inferior lip of the spine of scapula. So this part will give rise to the anterior fibers, this will give rise to the acromial part, and this will give rise to the posterior aspect. So this is the origin part, and it gets inserted down here in the deltoid tuberosity on the lateral aspect of the shaft of the humerus. We can get a little more technical regarding its pinnate nature, and the deltoid muscles, as its anterior fibers and posterior fibers have a little slightly different functions as compared to the acromial fibers. So the acromial fibers are needed more powerfully, so these are pinnate. So let me, okay, so the muscles are arising from four tendinous arches, and here it's inserted into these three tendinous arches. And let me get this more clear. So it is arising inserted into this pinnate aspect, and you will be seeing some pictures like this too in your textbooks. So these pinnate fibers, they interlace with one another like this, and like this, and that provide less range of motion, and the trade-off is it gives more power in them. So this is the origin and insertion, and let us talk about its functions. The acromion part is majorly responsible for abduction of the shoulder joint, the glenohumeral joint, and technically speaking, glenohumeral joint, the abduction is from the 15 to 90 degree. This is more abduction shown here. As you can see, as the abduction goes beyond 90 degree, it is made possible due to the rotation of the scapula. That is not the function of the deltoid. The deltoid's function is to abduct from 0 to 90 degree, from somewhere here to here. So this is the function of deltoid majorly. The function from 0 to 15 degree, as you can see, the deltoid is not highlighted. 0 to 15 degree, this is due to the supraspinatus, as we will see shortly. From 20 to 90 degree, this is majorly through deltoid, and the rest of the movement is due to this rotation of the scapula brought about by the trapezius and serratus anterior. To be more accurate, 15 to 90 degrees is not very much accurate, because it's not like the shoulder goes from 15 to 90 degree and then scapula starts rotating. The scapula is rotating throughout along with it. So for every 1 degree of for every 2 degree of glenohumeral, there is 1 degree of scapular rotation, so that is made possible due to it. Then there are the anterior fibers. The anterior fibers are flexor, adductor, and medial rotator. So they provide flexion, bringing the humerus to the anterior aspect along with the pec major. As you can see, this function is made possible because these fibers are approaching the horizontal axis of the shoulder joint from anterior aspect. Let me show you again. So this is the flexion function. Then the fibers are approaching from the medial aspect, so these are helping in adduction. As you can see, from abducted position it is brought to adduction, and now this movement is produced by the this. And last but not the least, medial rotation. As it is from the medial aspect, it is pulling the anterior surface of the humerus or medially, or it is technically it's pulling lateral aspect to forward direction. So it is pulling the lateral surface forward direction, so it is helping in adduction. So it helps in flexion, adduction, and medial rotation. With this, we move on to the posterior fibers of the deltoid. These are arising from the spine of the scapula. These will help in exactly opposite functions in the lateral rotation, extension, and abduction. Extension, lateral rotation. Let me show you. Here the lateral aspect is pulled backwards, so there is lateral rotation. You can see the palm of the hand is going to face outward direction. So this is lateral rotation. And as this muscle is approaching the horizontal axis from the posterior aspect, you can see right here, it is helpful in pulling the arm from in extension, pulling the arm to extended position from the flexion, and then also in hyperextension as shown right here. So, and these are the functions of the lateral head of the triceps. So we talked about the not triceps, the posterior aspect of the deltoid. We talked about the deltoid, its origin, its three parts, and the origin of the parts, multi-pinnate nature of the acromion part, and the functions of the three parts. And this anterior part was responsible for flexion, medial rotation, adduction, and this part was responsible for abduction from 15 to 19 degree, and this part was responsible for extension and lateral rotation. And the nerve supply is very important for this nerve. This nerve is muscle is supplied by axillary nerve. So axillary nerve, let me go back, let me highlight the muscle here, and yes, so this is the axillary nerve. As you can very well see, this axillary nerve winds around the head of the neck of the scap of the humerus bone before reaching the undersurface of the humerus, and as it does so, it is vulnerable at this point, because if you inject a person with intramuscular injection and the needle is misplaced and goes down the way all the way to the nerve, then this nerve can be damaged even improperly placed injection when it is placed here. Alternatively, when this neck of the humerus is fractured due to some injury, then this nerve can be damaged. Or is if a person having abducted shoulder leads to dislocation of the shoulder, this nerve can be injured. So in all of these cases, this nerve can be injured, leading to the paralysis of the deltoid muscle, leading to weakness of abduction and also the cutaneous splay over the aspect of the skin over the deltoid. So this is all about the deltoid muscle, its attachments, origin, insertion, nerve, and its functions. This is the muscle that whose function will be lost along with teres minor, and this is the area of skin whose function will be lost. This proximal aspect of shaft of humerus, this can be damaged too. Then there are rotator cuff muscles, subscapularis, supraspinatus, infraspinatus, and teres minor. Subscapularis is muscle that arises from the subscapular fossa on the anterior aspect of the bone. It arises from here and it goes on and inserts on the anterior aspect of the lesser tubercle. So it attaches here and it is supplied by upper and lower subscapular nerve, and this muscle pulls the anterior surface of humerus towards itself, so it is helping in medial rotation. Here is the origin and insertion of the subscapulary muscle with its function of medially rotating the shoulder joint, glenohumeral joint. And the nerve supply is through the posterior cord of brachial plexus, where it is supplied by the upper and lower subscapular nerves. That also the lower subscapular nerves goes on to supply teres major right here, as it can be seen going beyond the muscle. It is supplied by the arteries that are present on the scapula, and we will go into the different branches of axillary artery. We'll discuss in the axilla part. Then there is on the back we can see supraspinatus, infraspinatus, and teres minor. Let's start with supraspinatus, originating from the supraspinous fossa, inserting into the superior aspect of the greater tubercle. As you can see, when this upper part is pulled inwards along the anteroposterior axis, the arm will go upwards. This will help in abduction of the shoulder joint. Here is the origin from the supraspinous fossa, inserting into the upper part of greater tubercle, and this muscle being primarily active in the abduction during the first 15 degrees. So this part basically from here to here, this is majorly through the supraspinatus part from here to here. So this is the supraspinatus, although it remains active the rest of the part too, but especially from the first 15 degrees, this is due to the supraspinatus muscle. This muscle, along with the infraspinatus and teres minor, is supplied by this suprascapular nerve coming through this suprascapular notch. It supplies supraspinatus, goes through a spinoglenoid notch, and goes to the infraspinous fossa too. So this was regarding the supraspinatus muscle, and then there is infraspinatus muscle arising from the infraspinous fossa, getting inserted into the middle tubercle of the greater middle facet of the greater tubercle, and as you can see, it is approaching the humerus from the posterior aspect. When it pulls, it helps in lateral rotation of the scapula. Here are the origin and insertions of this muscle. The function of the muscle as being the lateral rotator of the humerus at shoulder joint, and the nerve supply as the suprascapular nerve comes through the suprascapular notch, passing between the spinoglenoid notch, going to the spinous fossa to supply this muscle. That brings us to the last of the rotator cuff muscle, that is the teres minor. It is rising from here, the upper aspect of the lateral border of scapula, and from here it is inserted into this lower facet of the greater tubercle on the posterior aspect, and this is the muscle that runs between these two parts, and as you can see, it will have function similar to those of infraspinous, that is the lateral rotator of the shoulder joint. Here is the origin and insertion of the muscle, along with the function as lateral rotator of the shoulder joint, like this. And the nerve supply of this muscle is through the axillary nerve, as it goes and winds around the humerus before supplying deltoid. It gives us a branch that goes to the teres minor muscle. So this is the axillary nerve going around the neck of the humerus, and this the further part going to the deltoid is cut right now. So this is its nerve supply. So these are all the muscles of the rotator cuff, and together these muscles are protecting the shoulder joint from all the aspects. On the anterior aspect, there is subscapularis muscle. On the superior aspect, supraspinatus, and posterior aspect, there is teres minor and as infraspinatus and teres minor muscles. So it is protecting from above, back, and forward, above, and back. And in addition to having their isolated functions, those were medial rotator for subscapularis, abductor for supraspinatus, and lateral rotator for infraspinatus and teres minor. These are the muscles that helps majorly, they help in fixating or stabilizing the glenoid head in the shoulder head in the glenoid cavity. That brings us to the last of the muscle that we're going to discuss today, that is the teres major muscle. This muscle arises from the lower part of the lateral border of the scapula on the dorsal aspect and goes on to get inserted into the medial lip of the bicipital groove as shown right here. From the lateral lip, I would like to remind you, was back major. On the bicipital groove floor, there was latissimus dorsi. On lateral lip, on medial lip, there was teres major. So here is the muscle with its origin and insertion. Along the horizontal axis, this will help in extension. As you can see, it is approaching the shoulder joint from back. So as it comes down, like now, it will help in extension, pulling it back. So this will be its function. From here, pulling it back. So this will be its function. From here, pulling it back, because it is approaching from the posterior to the horizontal axis. It will help as adductor, as the arm is in abducted position. Here you can see pulling it arm to the by the side. This will be made possible by a teres major along with other muscles like pec major, latissimus we talked about. So it pulls the arm to closer here. And last but not the least, this will be medial rotator, as it is attaching on the anterior surface and pulling the anterior surface medially. So as the anterior surface is pulled medially, this will lead to the medial rotation of humerus. So this brings us to the end of the muscles, and with this we will close our discussion regarding the muscle, and we will before finalizing. Thank you so much for listening. I hope so this had been helpful for you. If you have any questions or feedback or suggestions regarding this lecture, please mention down in the comment, and you may reach us through our website. By the way, all the recordings with presentation material is present there, and our Facebook and YouTube channel. Please feel free to reach out. If you have any queries and suggestions, please let me know. I will be trying to follow up with further lectures on the upper limb. Thank you so much.